I don't see, and I see now. The ability to see, or your sight, which opens the door to all the knowledge of the world. I'm Navneeta Nambiar, and today with me is our very own Dr. Ramamurthy, Chairman, Eye Foundation Hospital. Welcome, sir.
Thank you.
Thank you so much for taking the time. I understand you're a really busy person, and I've been trying to follow you around for a few days now. I visited some of your centers, mostly around South India. So it shows a lot of hard work, there's a lot of dedication there. And I believe this is not just one man done, the whole family is behind this hard work and dedication. I want you to tell me a little bit something or about your journey for the last 36 years.
Well, I passed out from the All India Institute of Medical Sciences. Then I was with Dr. Badrinath in Chennai for a couple of years. Then I started my branch in Tirupur, and subsequently we moved over to Coimbatore, and now we are, as you mentioned, all across Tamil Nadu, Kerala and Karnataka, in the cities of Bangalore, Kochi and Tirupur, Ooty, Mettupalayam, Pollachi, Erode. And the most important thing is not just the number of centers, but the fact that we try to ensure that the cutting edge technology is provided in each and every one of these centers. All of them are equipped not just to handle cataract or refractive errors, but the entire gamut of ophthalmology, delivering the best possible eye care for each and every individual who knocks on our doors. You mentioned about my family. They are important, but even more important to me is the set of about 36 consultants that we have spread across different centers, extremely well trained and motivated, and about 400 odd personnel who work with us, and it's the entire team which makes us work.
The entire team of Eye Foundation.
That's right.
Great, yes. You have helped so many people throughout these years, much appreciated. But something that we keep hearing these days is quality care. Any sector that you take, everybody is talking about quality care. What exactly is quality eye care?
Quality eye care, in my opinion, is the sort of convenience to the patient that you provide, so that he or she doesn't even experience as if they're going through a treatment. If we talk about cataract surgery, which is the most commonly performed surgery in the entire human body, and we Indian doctors perform almost 1/3 of the cataract surgery that's performed around the world. So today, for me, when a cataract patient walks into my hospital, whether he or she undergoes laser cataract surgery or the conventional phacoemulsification procedure, there is absolutely no restriction on diet. They are allowed to take all the normal medications. They come in the morning, get operated. The whole surgery lasts just for about 7 to 8 minutes. There's no patching of the eye, there's no injections. The whole surgery is done under topical drops, and the patient is allowed to go back home within a couple of hours of the surgery. And they can almost resume all their activities immediately after surgery, whether it's watching TV, reading books, traveling, cooking, playing a game of golf, driving, everything they can start. The only restriction we have for our patients is not to splash water in the eyes for a matter of 1 week. And in case both eye surgery is needed, we do it just 1 week apart. So because of this, unlike the olden days when people used to talk about maturity of cataracts, waiting for cataracts to progress, today we operate on patients whenever they are inconvenienced with the onset of cataract. So, and we also have multiple modalities like multifocal lenses, toric lenses, so that these patients can function without the need for glasses for all distances. An 80-year-old can go back home or back to even his office and get back to all their activities almost immediately without even wearing glasses. And it's at the age of 20 that a person is supposed to have the best quality of vision, any individual. And today we are able to give them back that kind of vision even in their 70s and 80s. It's not just the quantity of vision but also the quality of vision. So I do believe that we have come a long way in this journey of ours, and we are able to assure both the patient and his attenders almost 97 to 99% of the time high quality, very convenient outcomes almost each and every time we operate.
I've heard your people so lovingly calling you DR. That's, I believe, short for Dr. Ramamurthy. So that sounds absolutely lovely. Now, dear sir, tell me, I'm sure with all these years, you've also been, you've stayed the president of our All India Ophthalmologists Society as well. And you've surely come across that one patient or that one person whom you have helped to give or regain eyesight, and it must have really heart touched or felt really good about it. Can you share that experience with us?
That was amusing. DR could stand for doctor, but actually it stands for D. Ramamurthy, D being my initial.
Okay.
And as far as heart-touching experience is concerned, there have been several in my 35 years of dalliance with ophthalmology. But one particular patient I remember is one a person who came from a interior village in Tamil Nadu. He was 30 years old when he came to me. He had suffered bilateral injury. Both eyes had been injured, and one he had completely lost vision. The other he had been given up for as not adequate vision. Actually, he had been studying in a blind school, but then was brought for a checkup, and we found that he had a corneal opacity plus a lens which had been subluxated. We call it, is displaced from its place. So along with my cornea colleague, we did a corneal transplantation with him, and we did a complex cataract surgery to remove the lens, place some hooks, and support the intraocular lens in its place. So, and he had suffered this injury at the age of 10, and when he came to us he was 30. After almost 20 years of practically no vision, he got back almost 90% of his normal vision. And that was something which was not just vision changing but life changing for him. That's one of my memorable experiences.
That's really touching, and I think most of us we don't realize how important our eyes are, or the power to see is, until and unless we start experiencing the loss of it. So there's so much more to talk to you, there's so much more to ask him, and there's a lot of experience that he still has to tell us or share with us. So until next time, stay tuned. Thank you so much. This is Navneeta.